Hi, I'm Dr. Jeffrey Antimarino from Medispas Plastic Surgery. Welcome to another episode of our Hot Takes. That's a series that we started 2 versions ago. Now we're on our 3rd, where patients will send us videos and about some of the topics that they've seen on either social media or TikTok or something like that, and ask us to weigh in on what I feel is that real, is it not real? And it's been a lot of fun. So this week we have quite a few and some good videos. So let's start it off. I think the first one we're going to talk about is male procedures. And so for really about the last 7 or 8 years, the amount of men coming in for plastic surgery has slowly risen. The main 3 have been the same. First and foremost, men are always interested in liposuction, mostly of the abdomen, the love handles, and now a lot with the chest. So those are the big 3 for liposuction. The second most common is gynecomastia, or male breast tissue. And that can usually be done with a combination of liposuction and direct excision of the breast tissue. So that's a popular one. And lastly is facial rejuvenation. So we had men coming in mostly for eyelid surgery. They're getting a little bit older, they start to look a little more tired, but also facelifts and neck lifts. So with the onset of the GLP-1s that a lot of patients are taking, guys are taking more pride in how they look. They're working out. They're starting to see a little bit of that sagging now, a little bit of that extra skin. So the facial rejuvenation procedures have been on the rise as well. So for guys, it's been the same 3, but slowly increasing over the last few years. I think the next one is about Botox parties. Okay, so I've weighed in on this before. I'm not a big fan of Botox parties. My feeling is these are medical injections, they're medical treatments. So anything Botox or any neurotoxin, dermal fillers, lasers, anything that is a medical treatment, I think it needs to be done in a medical facility. I think being done classically, Botox parties were done at somebody's home. Somebody, some type of provider would walk in the door. There was usually alcohol involved. It was a fun time. And I think that takes the professionalism away. Plus, you have to sign consents. These are procedures that do have some risk associated with them. And although in the right hands, the risks are small, I think when you start combining alcohol, signing legal documents such as a consent, I think that impairs you. So I'm not a fan of that. I think you should just be done in a formal setting. But that's being said, I think you still need to do your homework. Who's doing your injections? Where is it being done? What's that facility like? Who's trained to do it? And so there's different levels of providers. And so there are some treatments that a medical assistant can do. There are some that an esthetician can do. There are some that a nurse has to do, or a PA, or a nurse practitioner, or a physician. Depending upon where you live, the rules can be very strict. So you have to be careful, especially with new spas. Not that they're bad, but you have to know a little bit about them and who's doing your treatments. Next one I think is pineapple juice. Pineapples are a big fan for me. Well, I like them. But pineapple juice does have what's called bromelain, and that's the key component that helps bruising and decrease inflammation. Depending upon how that pineapple juice is processed, you may not get as much bromelain. So what I usually recommend to patients is eating pineapple. Fresh pineapple works great. The other thing is Arnica montana, which is an herb. You can buy it at a health food store. They come in just little dissolvable pellets. They look like little BBs, and I usually have my patients start on those about a week or so prior to surgery and about a week or so after. So that Arnica montana and the pineapple I've been recommending for years. I think it's great, especially for facial, any type of facial procedures. I think it does help decrease your risk of bruising. Next one is there's a rise in eyelid surgery, and I do see that. There are more patients coming in for especially upper eyelids. So upper eyelids can, you start to get that hooding, that severe hooding, the skin's now overhanging the eyelashes. It can make you look tired, but it can also be a problem with your vision. So a lot of those patients are walking around all day really arching their eyebrows to pull that eyelid skin up. So it can be a genetic component. It can also be a normal aging pattern depending upon your age. So if you're having that issue, be evaluated, there is a chance that insurance companies would pay for that. You'll have to undergo a visual field test with either your optometrist or your ophthalmologist and see if there's an obstruction, especially on the outside of your vision. If that's true, it can be submitted to your insurance company. Lower eyelids have always been something that patients want to talk about because they get that herniated fat, that fullness. It kind of makes you look tired. So there's always been tried and true surgery, but there are some other modalities now that I've been using with good results, consistently good results, called Virtue in our office, microneedling radiofrequency. I think that's also a good option for patients. So yes, eyelid surgery is always going to be, one of the more common procedures that patients are going to want to know about. Yeah, so there is a lot of talk about patients going to Turkey, mostly for hair transplants. And so my thought on that is there are some places in Turkey, and I've seen some tremendously good results from there. So I think as long as you do your homework. So let's, just not talk about Turkey, but anytime you're going to travel outside of your area, outside of the state, outside of the United States, where you're going someplace else, you have to factor in the fact that you have travel time now. So you're going to leave your home state or the United States, go to a foreign country or to another state. There's travel expenses, there's hotel expenses. You're going to have surgery there, you're going to fly back. What if there's a complication? What's your follow-up going to be? So there's not going to be surgeons in your area that are going to want to take on seeing you post-surgery because they didn't do the surgery and they're not going to take that risk. So you have to factor that. And it's amazing to me how many people don't think about that. The whole surgical process takes about a year for your completion. The surgery is just part of that, and it's a small part because all of the healing afterwards you have to take into consideration. We see in this practice patients calling saying they had surgery done elsewhere, now they have drains, they have sutures that need to be removed, staples that need to be removed, they're having a complication. There's not many people that are going to want to get involved. If you go to another country, not to say that that's bad, but you have long flights, you're going to have to be in a hotel situation. What's that doctor going to be like? Different countries have different qualifications for who can do those surgeries. Here, when you look for board certification, they may not have that in the country you're looking. So it could be anybody doing your surgery. You don't know that. It's hard to do your research for other countries. Not only the surgeon doing it, but what's the facility like? Is it a clean facility? Do they sterilize their instruments? Do they have things that are not outdated that they're just using because even though they're expired, they want to get rid of them? What's your post-op going to be like? What's your management going to be like? So then you got to get back on a plane. And sometimes patients are traveling 14, 15 hours on a plane. After surgery, higher risk of infection. You have a higher risk of clots, DVTs, pulmonary emboli. So you have to take all this into consideration. So it's not that those places are bad, but it can be much more complicated. And chances are you're going to find somebody in your area that's board certified, completely capable. And I understand a lot of patients will tell me it's because of the cost. Well, factor in everything I just told you, and you're going to see that the costs are probably not that much different. Plus, factor in your risk factors. So you got to be really careful leaving the country. This is all I want to say about that. Yeah, so Facelifts Before 40 is very few patients that I've seen in my 24 years in private practice that would qualify for a facelift or a neck lift before 40. Now, that being said, now with a lot of patients losing weight on the GLP-1s or from surgery, I have done 2 facelifts on patients that are in their late 30s, but they had lost about 150 to 200 pounds. So yes, it's possible that somebody in their late 30s would benefit from a facelift. If you haven't lost a lot of weight, and you're just starting to see in your late 30s, early 40s, where you're just starting to see a little bit of aging, a neck lift or a facelift might be a one possibility for you. But at that time, most of the patients that I'm seeing, there are other modalities that can be used, where it's dermal fillers, fat grafting, microneedling, radiofrequency, skin resurfacing, tightening of the skin that way, that can benefit you without the incisions of facelift or a neck lift. Also, the downtime is different. So think about that when you see a plastic surgeon. Ask them about those modalities as well, because the majority of the patients I see in that age group can benefit from the non-surgical or minimally invasive rather than going into surgery. There's a gentleman, the patients have sent in a video, Daniel Barnett, I think, out in California. He does a nice job. He explains that well. So if you've watched that video, I think he's giving good advice. It's pretty similar. Yeah, I think this is something we talked about in the past, and so it's always hard when the bride or the bride's mom or the groom's mom comes in and they want to talk about I'm getting married, or I need to get some stuff done. Here's some prep time for you. So most obviously brides, most of them are younger. So when you talk about neurotoxins, dermal fillers, laser resurfacing, microneedling, radiofrequency, that can be done. I would recommend doing any of those things, especially with the dermal fillers and the Botox, because they're injections and there's a small risk of bruising. Do them about at least a month before, 4 to 6 weeks, because you'll still have all the duration of the neurotoxins and the dermal fillers for months after that. Laser resurfacing, everything, it would be just perfect. Your skin will be healed. You'll look great. You'll still have that good glow of your skin. So those kind of things, 4 to 6 weeks. When you start talking about breast augmentation, breast lift, liposuction, tummy tucks, things like that, now I would tell you start planning months in advance, 6 months at least. You want to have time to heal. You want to be back to your normal activity. And then if there's any little scar visions or anything, little touch-ups that need to be done, they can be done prior to the wedding, because you also have to remember, once you start buying your dress, all the alterations. So you want to have all of that done before you start having the alterations. And so that's something that we talk to the patients about, especially if she already has her dress. Then whatever we're going to be doing. Breast reductions are actually a big surgery prior to weddings as well. And again, that's going to be a big alteration on the dress you already bought. So start thinking 6-9 months earlier at least, and then you'll be well healed and it'll be easier. Now, for the moms of the bride and the groom, same kind of thing. Most of the time, that's going to be same types of breast surgery, liposuction, tummy tucks, facial rejuvenation. Start thinking about that a good 9 months prior. Plan it in, because again, as you get closer to the wedding, you're going to have other things, other anxieties and worries. You don't want to be worried, am I going to be healed in time? Are the scars going to be faded? Just put it out of your mind, get it all healed up, and then you can go through the normal planning of the wedding, but get that out way before. Start thinking about that early. Lip lifts, I don't do them. I think I've seen some really nice results. And so what I'm seeing, that especially the videos, yes, I think there are some great results out there. However, being trained in plastic surgery and reconstruction, I've done plenty of cleft lips in my day. Those scars don't always heal like the ones that you see in the videos. You're seeing those that heal beautifully, but sometimes, especially in that what we call the alar crease, sometimes that can get thickened and it can stay pink or discolored, and it can also, that sharp little indentation here, sometimes it's very difficult to reconstruct that. I guess for the most part it would heal well, but it's enough times where it doesn't. And so the lip might be in a better position, but now you have those scars and they are visible. So I've chosen in my practice not to get involved with that. I think there are some other ways of doing some lip augmentations that help with that, but I have seen good results with it. Personally, I think it's a little too risky. So I think we've gotten through everything that everybody wanted to ask in this last episode. So I look forward to seeing you at our next one in about a month. Please send in any more videos, reels that you want me to take a look at. I hope this was helpful, and I'll see you next time.